Doris, I just want to ask you some questions about your memory, and we'll be about 20 minutes to a half hour, okay? So I can get some idea about how you're thinking. Have you had any trouble with your memory?
No.
No, it's been pretty good, huh? Yeah. Do you know what day it is today? Monday, Tuesday, Wednesday, Thursday? I told you I was going to be annoying. Can you give me your best guess what day it is?
I'd say Thursday.
What typically I think you would do is do a short battery, and off that battery where you see deficits is to push it. You'd not go beyond 2 hours, maybe 2.5 hours.
What do you notice that's a problem for you?
So you'd want to get a read of their cognitive domains, and largely they involve attention and language, visual, spatial, memory, and executive functioning. And you'd want to get a sense of their baseline, where they were in their life, what their premorbid personality and intelligence is. And based on that information, along with their affective status, whether they're depressed, anxious, somaticized, and having difficulty with agitation and suspiciousness, they tend to be the 98% of the problems that you get with people.
And you've not really noticed anything that's terribly different for you over the last 2 or 3 years, huh?
No.
Okay, okay. Things are pretty good at home?
Mm-hmm.
Your mood is pretty good? You eat okay? You're feeling okay?
Yeah.
That's good. That's good. And everything is pretty cool with you and your husband, huh?
Mm-hmm.
Great. How many children do you have?
2. None now.
None now. But you had how many?
Just the 2.
2. What were their names?
Beverly and Billy. They both were married.
They both were married? Where are they living now?
We don't have any children right now. They did.
Once you get an understanding of those components, you then can pretty much help the person where they're at and make a reasonable projection of what needs to be done in the next 6 months to a year with where the person is going to be.
Do you get feelings about that when you do talk about them? Mm-hmm. You do. So right now, are you feeling a little sad? Mm-hmm. Okay. Thank you for telling me.
Now she is down in attention, she's down in language, she's down in visual spatial, she's down in executive functioning, and her memory is atrocious. Not only her short-term memory, but she can't remember when she was married, where she grew up. She gets her kids confused, so she's impaired. So we saw that in the assessment that was given to her, and we did a light battery in the sense I wanted to get a sense about each of the domains without getting absolute numbers in all of them, because that wouldn't serve us very well. This woman is so impaired.
Do you find yourself sleeping a good deal during the day?
No.
No. Do you sleep okay at night?
Mm-hmm.
You do? Okay. Are you tired during the day?
Sometimes.
Sometimes? I noticed you were kind of nodding off when we talked a few minutes ago. Did you notice that?
Yeah.
You did, huh? So you'll do that on occasion, huh? Okay. Do you do much reading or do you watch TV?
Well, both of those things, yes.
You do. What's your favorite television show?
I can't think of them.
Okay.
Just turn them on and watch them.
You just turn them on and watch them. What's your address? Do you know your address
Yeah.
at home? What is it?
It's 78
78
Curtis Street.
Curtis Street. And what town?
That's Newport.
Okay, so I'm going to mention 3 words,
Okay.
and you say them after me when I'm done, okay?
Mm-hmm.
Apple, penny, table.
Apple, penny, table.
Super, super, super. Can you do me a favor? Can you pull out your mathematics hat and subtract 7 from 100?
It was clear that she did not need a lengthy battery, that what we were into was someone in the moderate stages of dementia.
93.
Good.
Her memory is not going to be her friend.
Do you remember those 3 words I just asked you to remember?
No.
You remember any of them?
No.
No?
For example, she could not remember 3 items within 1 minute's time and could not do that over a period of time. She also had poor visual spatial skills to such an extent that she didn't quite realize that the 2 figures that she drew were different.
Do they look alike to you?
Yeah.
Okay. So you did a pretty good job, huh?
No.
What's the difference?
Well, there's a spread out better.
Yours is spread out more, huh? Okay. What are those 3 words I asked you to remember? Do you Can you tell me what they are?
Maybe we could train her up to be able to do some of these things. And the question would be, at what cost? Would that really provide outcomes that are better quality of life? I think one way to think about it is sort of the sloppy clinician way, which is, look, she's at about an MMSE of 13 or 12, or in that ballpark, and she's pretty mellow. Let's see if we can't push her a little bit and do things that would increase her chances of learning a little bit more.
Do you remember those 3 words I just asked you to remember?
No.
You remember any of them?
No.
No? I'm going to say them again. You say them after me, okay? Apple, penny, table. You say those?
Yeah, apple, penny, table.
Good.
I was going to say apple before,
Yeah.
but
You were, it was on the tip of your tongue, huh?
Yeah.
Okay, okay. What's this right here?
that's a watch.
That's a watch. What's this right here?
There are 5 million dementing people now out there, and of that, about 20 to 25% are in
thing right here?
pretty poor shape.
That's a pencil.
That's a pencil, or is it a pencil, or is it a pen?
We have a moral obligation to sort of better understand that group
Can be combination.
and to know what it is we can do to make a
What's
difference.
this right here?
And nobody has the manual yet, but I think we have some ideas that are not bad.
I forget.
Uh-huh.
I think it's important to take a look at the big picture and to see what are the strengths and the weakness, and the rehab works on the strengths to see if they can pull up the weaknesses.
Yeah.
And then you're doing exactly the right thing.
Yeah. You know, I walked into nursing homes where a person with an MMSE of 13, like our patient today, has no interest in doing anything beyond that. And so you sit back and you say, well, what's my obligation here? You know, how can I prime the pump here a little bit more without pushing her over the cliff? That gets tough. And so you bring in all the help you can there with the nursing assistants, with the family, with her, with what you know as sort of motivational interviewing for a 13 MMSE, and that takes some doing. One thing we didn't assess real judiciously, although we do know she can read. And many people who are in that level can read fine. They can't comprehend or remember, but they can read the newspaper. And so a friendly intervention would be just read the first paragraph of the paper. You've done this all your life. And talk to John about it.
What's that called? No? That is a weapon?
Yeah, it was a weapon.
What kind of a weapon?
Cannon.
Cannon. Good job. Good job. What about this one?
That's a sailboat.
Yeah.
She might get stuck, in which case you'd make it simpler. So we'll look at some of these basic coloring books and maybe what's going on in this picture. And if she's tolerating that, that's the marker. And you would then continue with that and expand on that.
All right. How about this one? What's that called?
I very much appreciated Cohen Mansfield's stuff because she was saying, look, these are people who we don't have a clue with what's going on in their brain. It's so decompensated. But we know who they were.
Okay. What's that called?
That's a camel, I think.
What other possibility could it be?
And we know what they used to like. And we know if we give them things they used to like, they seem to light up and it optimizes their time. And other methods have been used similarly with these loop tapes and such, where people are listening to their son talk to them repetitively. And people seem to be able to handle that and light up. And so any given person might say, no, I don't want this, but most seem to get something out of it.
We're almost done here. I want to just ask you to do something. What's my name?
I forgot.
Okay, I want you to remember my name. It's Dr. Heyer. Can you say it for me?
Dr. Heyer.
Yes. Now tell me again where you were born.
I was born in Somerville, Mass.
Somerville, Mass. What's my name?
I forgot.
Okay, what's my name?
William
My name is Heyer or lower?
Heyer.
William Heyer. Dr. Heyer. Yes. Okay. So what's my name?
Dr. Heyer, William Heyer.
Okay.
Okay.
Just Dr. Heyer. Thank you.
You're just organizing the environment to make it fit the person's skills. We need a better job of defining what the person's skills are and a better job with knowing the best environment to do that.